Yes.
Level check for us.
Jill Ludford, Chief Executive of the Murrumbidgee Local Health District. Well, good morning, everybody. I'm here to provide our COVID update on this really important day, I think, for regional New South Wales, where we're seeing travel opened up from Sydney and also from our Victorian counterparts. So we here in the Riverina, of course, welcome our travellers to the region. It is actually a really important day for our businesses. If we have a look at where we are here on the 1st of November, Christmas is around the corner. And I wanted to talk today about a slightly different messaging as we learn now to be living with COVID. We've come out of a very different environment where we were talking about elimination of COVID cases and in lockdown to now where we're talking about living with COVID. So today I wanted to start by talking about what we're seeing in our hospitals, because now we're in a largely vaccinated population. The messaging, I think, to our community each week needs to be about what our vaccination rates are and what is the impact on the health system. So extraordinary. I couldn't believe it when I read the results this morning. At 96.6% of the people who live across the Murrumbidgee Local Health District have come forward and had at least one dose of their vaccination, and 84.4% of our people are fully vaccinated. So that offers our community an incredible sense of protection, but I did also want to stipulate where the vulnerabilities lie. But before we do, the impact on our health system at the moment is really minimal. Now, we need to put the caveat around the fact that obviously Albury-Wodonga Health provide health services for the Albury-Wodonga region, so the numbers I'm about to talk about exclude Albury citizens. So at the moment, we have only one person in our hospitals across the Murrumbidgee, and we only admit COVID patients to Wagga Wagga and Griffith, and we have no patients in the intensive care unit. We have 35 COVID cases who are receiving clinical care through the hospital in the home. So we've really seen those numbers really come down over the last few weeks as more and more people are protected through vaccination. Where I remain concerned, and particularly as we see regional travel opening up, is for our vulnerable communities, and we're seeing that at two different extremes in age. So as we're seeing playing out in Albury, our children under 12, there is no vaccine yet for that cohort of our population, and we are still building on the numbers of people who are double vaccinated for the 12 to 16-year-old age bracket. So my message today, parents, is if you have not yet had your child vaccinated, it is absolutely vital that you think about getting advice, talking to your GP, talking to your vaccination clinic, and really bringing your child forward for vaccination to help keep that person safe and your family and your community. As we've seen, once COVID cases get into schools, it is very, very difficult, and whilst children don't necessarily become particularly unwell, that then just spreads the virus to other vulnerable gaps in our community. And again, aged care, residential aged care facilities, it's really dire when COVID enters into a residential aged care facility. So our numbers for today are 14 new cases in the Albury LGA and 1 in Greater Hume. And there's 1 in Griffith, 8 in the Murray River, 1 in Wagga Wagga and 1 in the Berrigan local government area. So 26 cases to 8 o'clock last night. Sadly though, very, very sad to report that a man in his 70s and a woman aged 101 who acquired their infections whilst in a residential aged care facility in Albury have died, and I would like to express my heartfelt condolences to the families, friends and the community of those residents. And there's now been 5 deaths linked to that outbreak, and that's what we see when we see COVID getting into our vulnerable population areas. So there's lots of work with all of the aged care providers in Albury. There's a large number of aged care residential homes in that region, and all of the providers have been very, very forthcoming in working together with the local health district and our public health unit to ensure that their facilities have done all they can to maximise the safety of people in those facilities. So testing's still important at this time, but I just want to say, if you don't have symptoms, you don't need to have a COVID test, because all that tells you is that you are not COVID positive on the day you are tested. It doesn't mean to say that you might be exposed at some other time and test positive, so it gives people a false sense of security. But we still do urge people, even with the mildest symptoms, to come forward and have a test. And we did over 6,000 tests in the district at our local health district testing centres through the week, so we're still getting a really good response. Sewage testing still has a part to play, although when we're living with COVID, we will have cases in and around us. And as we've talked before, people who have recovered from a COVID infection can continue to excrete some of the COVID fragments for some period of time afterwards. And we have seen COVID detection in Leeton for quite some weeks now. So we're really urging people there to please, if you have even the slightest of symptoms, do come forward for testing so we can try and work out what's happening in that particular local government area. Another important message today is the vaccination boosters are suddenly here. We heard about 2 weeks ago that the third dose for people who were immunocompromised was available, and we've started to administer those third doses. That's for people who are, for example, on renal dialysis or who have a cancer or an autoimmune disease. But for the boosters now, it's a pretty simple message. So the first thing is, to be eligible, you need to have had your second dose of your vaccine 6 months ago. And we again are taking walk-ins. We're making it simple for people rather than appointments and complexities on websites. But don't come forward unless you had your second dose 6 months ago. And if you recall back when we started our vaccine rollout back in March, that was largely our emergency service providers and our healthcare workers. So we've started vaccinating our doctors and nurses today, and we really are very pleased with the response that we're seeing. We're also focusing very much on aged care facilities, as they were in that priority eligibility group when we started. So we'll be vaccinating madly with third doses. It's all Pfizer, and it doesn't matter what vaccine you had for your first dose, whether that was AZ or Pfizer, all of the third doses and the boosters will be a Pfizer booster, and has been shown right across in the research so far to be very, very, very successful. I just wanted to finally touch on venues. There's been quite some concern in most communities about how venues are now being communicated, but particularly with the Service New South Wales app, when you QR code into a facility. So my first message is, if you get an alert on your QR code, all that means is that you need to monitor carefully for symptoms. It means that there has been a COVID positive case in a venue where you were, but it does not mean that you are a close contact or even a casual contact. And if you have not been contacted by the public health unit, you are not at risk. So you just need to monitor carefully for symptoms. That site will not necessarily be a venue of concern. So venues of concern will be publicised on the venue website by New South Wales Health. But the public health units carefully consider they will only put those venues up for publication if they are concerned there may be a risk to the public. So I guess the message is, as we are now learning to live with COVID, we all just have to monitor ourselves really carefully for symptoms at all times. Do not go to work if you have any symptoms. Where we've seen quite a lot of transmission is in workplaces, and particularly for people when they have lunch or they have cakes and birthdays. So we really encourage you to do those things out of doors and to make sure that your lunch places are particularly safe, or that you go outside somewhere. So we all need to really make sure that we scan in when we go out, wash our hands, maintain our distancing, and obviously wear our masks where we can't correctly social distance or if we're inside in a venue. So I'll leave it there and I'll hand over to my colleague to talk about how we went with our compliance over the weekend and our education around living with COVID-19. Thank you to Superintendent Winston Woodward.
Thanks, Jim. Good morning, how are we? I suppose it's easy if there's any questions you'd like to ask around.
Yes, so just tell us about how compliance has been over this weekend.
It's good. Actually, it's quite pleasing to say that the licensed premises, we didn't have an issue. Businesses are going really well, and now that New South Wales has opened up, I'm hoping that it continues along that line. But maybe some people will be hesitant to get out and about, but I think overall we've done really well.
You had two businesses we were focusing on last week as well, just in terms of checking vaccinated people. How have those businesses gone since we last
Yeah,
spoke?
I think that everything is picked up. I think that we're on the right track, and like Jill has said, the police themselves, even though there is the public health order out there, like to move into that educational role of getting around and letting businesses know that they have to. Some are still a little hesitant to ask the question, and I think it's just something that we will get over as time goes by, but it's one of those things they have to learn, that they do have to ask if they're vaccinated, and we do have to QR code into businesses, and I think it'll become even more a daily activity as we go on.
And regional travel has resumed today as well. Have we seen the roads a little bit busier, and are we changing the way that we police the roads again?
We've got our normal response out there. We've got a couple of operations coming up in the near future and across a couple of weekends. Look, it's opened up for vaccinated people. You have to be fully vaccinated to be able to travel, but then again Melbourne has opened up as well. So a Melbourne person who's fully vaccinated can travel out, come into Albury, come to Sydney, and vice versa. So on one hand it's good to see. Let's just hope that our education gets through to these people about still complying with QR and being vaccinated.
In terms of people travelling on our roads, as you just said, in terms of the vaccination, how will police be monitoring that or checking that? Would that be part of a normal pullover, or how will you look at those sort of things?
I think if you come under notice for a traffic offence, you'll get pulled over and asked a few questions. I can't imagine at this time that we will be just targeting people driving down the road, because we're open for business, as they say. I just hope that education side sinks through as I did. I should say you shouldn't be pulled over for a traffic-related offence anyway, but if you do come under police notice, they'll probably ask a couple of questions surrounding COVID.
And on that, any message, I suppose, to motorists who might be coming down from Sydney, who certainly haven't been out and about for a long time, who might be sort of tempted to flout the rules? Any message to them?
Just be careful, be sensible. Don't drive stupidly. Remember that you're coming into a region where the Riverina's done a lot of hard work to get where we are today. We've seen, as Jules said, how easy a little cluster at Albury can get out of control, and we just don't want it. It's not out of control, but you can see it flare up quicker. We don't really want that here. We want to get back to business as normal, and it's not really, as I've said before, it's not as if police like enforcing that type of legislation. What we've been through over the last 12 months, we're the same as you with families and that. We just like to get out and about as well. But I hope people coming from Sydney and Melbourne just take their time. A little bit increased traffic on the road. We might not have travelled for 12 months. Remember fatigue, remember speed, remember mobile phones. All that will come into play, and you will come under notice if you're detected with any one of those offences.
And you mentioned you have two compliance sort of operations maybe coming up. What will they be focusing on? When will they come into play?
Look, over the next couple of weeks. Can't let the cat out of the bag too early, just in case. We like a little bit of a surprise element with some of the operations we do, but it's always good to put people on notice that we do have... look, it's no unnatural phenomenon leading into the warmer weather that the licensed premises open up and traffic gets bigger. So if I was a betting man, I'd probably look around those two areas.
From me.
Okay.
Is that okay?
Thank you. All good.
in terms of rapid testing. The rapid testing was promised by the state government last week. Have they arrived yet, and when will they come into play here?
So the rapid antigen testing for schools in the Albury local government area are in transit. In fact, I think they've arrived and being packaged up ready for schools and will be implemented there in the coming days. And just to reiterate that this is a circuit breaker, particularly in our school system, to give parents that level of confidence that they can continue to send their children to school. Continuous learning is so important for children, and it's been interrupted with breaks and lockdowns. So giving parents that level of confidence that they can send their children to school safely has been fantastic. And Dr. Kerry Chant visited the region and I escorted her around Albury on Friday, and we met with principals and also the parents of schools, and was really valuable conversation. And if somebody who is rapid antigen testing at home with their child, if they receive what we call a non-negative, which is comes up as you need to have another test, the message is please come into the New South Wales testing clinic in Albury, and we will undertake a test for the child, which is the normal PCR test, and we'll look to get those results back to parents and to the school as quickly as we possibly can. But that same day, the school and the parents will know the real result of the test. So rapid antigen testing isn't foolproof, but it really does provide that level of surveillance and assurance for parents. And it's going to be a really important circuit breaker for our schools in Albury.
Where will this be used? Is the idea to roll out at every single school or certain schools, or what could this be?
So I really suggest you talk to the Department of Education about their rollout. Obviously, as health, we are there to support schools in this program. My understanding is that all the schools will be participating, both primary and high schools, in the public health system, public school system.
And you touched on it, but I suppose it's hoped that this will ease the disruptions that we've seen for many schools, particularly in Albury recently.
And it has been a really difficult time for parents in the last couple of weeks. And I think we've talked about how we're changing our thinking about living with COVID. And as schools now, over the last week in Albury, have gone through a process where they have had to understand the contact tracing process, and they've got really good at doing that now and doing it in a timely way, so that we can actually identify those children who are close contacts. And I just want to reiterate that it's not the whole school that's affected, it's just a particular cohort of students, whether or not that's the classroom or whether or not that's the school kids that were on the bus with that particular student. But we shouldn't see whole schools now going non-operational unless, of course, there's something really significant going on. So our principals are doing a really magnificent job, and they're doing that in a timely way. And the message for people who were so impacted last week in Albury, also clarification that both parents don't need to self-isolate with the whole family. The child is the only close contact, and will just need a carer, and parents or a parent can continue to work.
While we're on Albury, those two aged care residents who sadly passed away, were they vaccinated, and how are other people in that facility coping or going in terms of symptoms at the minute?
Yes, so both of those residents were fully vaccinated, but I also have to say that they had other complex illnesses as well, and we see that sometimes COVID attacks at the weakest point, and it's really difficult when somebody also has a large number of other comorbidities or other diseases that they're trying to deal with. And so look, that management of COVID in an aged care facility can be quite time consuming, and we always look to try and keep people in their home because that's where they're most comfortable, and bring the clinical care to those aged care residents. And we will continue to test them on a regular basis and keep them isolated away from the rest of the residents in the facilities who are well.
Have you seen any reduced COVID cases in Albury over the weekend as well? Is this a promising sign?
It's going to take us a while to get on top of the COVID outbreak in Albury, particularly as we've talked about it being in those two extreme age brackets, young and old. But it is good to see that people have come forward for testing, have got into isolation early, and that's, as we see, will reduce the transmission. And being a highly vaccinated community, over 95% of the Albury people have been vaccinated, and 83.3% of them fully vaccinated. So that in itself should start to see those numbers stabilise in the coming weeks.
Yeah. And regional travel obviously did resume today as well. Is there any concerns given that we're in the midst of an outbreak?
Well, I think we just need to understand that we will have outbreaks from time to time, and we see in Victoria that they've still got some relatively high case numbers. But as we need to stipulate, it is only people who are fully vaccinated, who are asymptomatic, who are able to travel. And if we all abide by the COVID safety rules and orders, then we should be able to resume our lives and have a semblance of normality again.
Jill, I know the Health District always said that you'd expect a bit of a spike in cases when we do see travel resume and things opening up. Is that something you're preparing for now? And do you expect it to be slightly higher, given that we do have that outbreak, as we just mentioned, plus the travel at the minute?
Yeah, and certainly our clinicians, our doctors and nurses have been thinking about this and ways of keeping particularly our patients in the hospital safe. So, for example, over the next couple of weeks, we are going to COVID test patients who need admission into Wagga Wagga Base Hospital, just as that added level of protection, so that we can make sure that we absolutely know the COVID status of people while we go through this transition period. And again, that's something that's been widely used in Sydney during the outbreak there as well.
As in people who might be coming in for surgery or something?
Correct.
Yeah.
Yes. So we just ask people who have got a planned admission just to work with us. And it's really important, I think, for us just to make sure that we've got our hospitals as safe as we can possibly make them. And we already have COVID pathways for people who are symptomatic. But of course, now we've got a highly vaccinated population, we want to make sure that there aren't asymptomatic people also coming into our hospital system and then possibly, again, finding that vulnerable sick population group. Yeah.
And given our vaccination rates do seem to be tracking along quite well, is the Health District confident that we did make the right choice in setting this date for the resumption of travel as well?
Yes, and look, I also just have to say that it is really important for businesses, and when I was in Albury on Friday, Dr. Chant and I met with a number of businesses, and it really is important that government and government officials like myself listen to the impact that health decisions make on businesses. And the viability of businesses going forward. So it's that balance around safety, health, but also the prosperity of our community. And certainly businesses have done it tough, particularly with lockdowns and close downs. And I think we've got some really good guidelines now about how to be safe. And with so many of our population vaccinated, and now we've got the booster as well, we can really, I think, go forward with confidence that yes, we're going to have to live with COVID, and it's going to be a bit of a up and down period of time where we do have outbreaks. But we've learnt to do that with influenza. We've learnt to do that with other communicable diseases. And I don't want to compare COVID with influenza, but I'm using it as an example of how we've learnt to live with it. Yeah.
And just going back to the Mercy Place Aged Care Centre, has there been any discussion in changing the way you guys have set up the centre following these recent deaths? And how would you describe what the outbreak is like there at the moment?
So when there's an outbreak in a residential aged care facility, the Commonwealth Government and the state government have an agreed protocol of how to manage an outbreak. And as you know, the Commonwealth Government has a Quality Safety Commission that oversees aged care. And they sit in on daily meetings with the local health district and of course the aged care provider, who have a responsibility as well, and particularly around making sure that the infection prevention and control mechanisms are solid, and in particular that the staff and the residents are isolated into one area of that facility to really reduce transmission across other parts of that facility. And that's what's most critical. But once you get a COVID case into an area that's been shared by residents, it is just about treating people and keeping them comfortable and safe.
And I know you guys mentioned in the media release that you were expressing your sympathies to the families and loved ones of those that have passed. Would you like to expand on that at all?
Well, we're obviously very saddened to hear of any death, particularly of somebody who is vulnerable. But I would just like to say to families that I know it's really difficult, and particularly over recent months where they may have been in lockdown and not been able to spend as much time with their loved ones when aged care facilities were not able to accept visitation. So I think now that we just need to give people the opportunity to be sad and to express their grief for their loss.
And we've had a couple of cases pop up in Wagga over the past week. What can you tell us about those cases? And do we know anything about where they caught the case, and if the cases are related?
So I think we really need to move away from where did this case come from, where did that case come from, because COVID, as we said, will be all around us, and instead focus on really getting people tested early, getting people into isolation and minimising those clusters that are linked to each other. So what I can say about the cases here is they are linked, and people have done the right thing. We've identified the close contacts, they've been tested, and some of them have tested positive, and particularly in a family group, we know that's going to happen. So if people can just continue to be vigilant, continue to monitor for symptoms, get tested and get into isolation early, we'll get on top of the outbreak.
Yeah, and you mentioned testing there. I was wondering if you have the numbers of how many people got tested here in Wagga over the weekend and how that compares to back before we had any cases.
So we can provide you with that data, but I can say that 2,027 people were tested over the last 7 days, I think it is, Sam. But Sam can provide you with the comparative data. Yep.
And is it possible to get info on how many close and casual contacts have been contacted in the last 7 days here in Wagga?
No, look, we don't release that sort of information. I think it's important that we keep, when we're talking low case numbers, we have to keep the identity of people confidential. We have that obligation to people from privacy perspective, so we don't talk about the numbers of close contacts. We talk about that with the families and the people, and that's important. But I think the message to the community is there's a small number of cases here in Wagga. They're linked, and people are doing the right thing, and I think that's all the community need to understand.
Jill, just a quick question on the Griffith Hospital redevelopment. I know that's reached a bit of a major milestone this week. Can you tell me what's on offer now and what the next steps are for that redevelopment?
So the Wagga Wagga redevelopment, so we are going through the car parking.
Sorry, Jill, Griffith.
Oh, Griffith.
Yeah.
Look, I'll take that one on notice because, yes, there's lots going on there, but I can provide you with more information. Sorry, I heard Wagga.
No, you're
yes.
I suppose generically speaking, though, it'll be a great redevelopment for that area.
Yeah, well, the Griffith redevelopment is seeing the commissioning of what we're calling their support services block this week. So 2 weeks ago, we moved into the temporary paediatric wing. And now we're moving into what we call our support services block, which is the back of house kitchen and cleaning and maintenance. And so that's going to free up the site then for commencement of construction of that beautiful new build. So very exciting time as we go through the next steps in the Griffith Base Hospital redevelopment.
And just lastly, in terms of Wagga's sewage as well, has that returned any more positive readings for fragments since the last occasion? And if so, is it still a low reading, or has it picked up at all with these new cases?
We'll take that one on notice for you. We'll get some information from Tony Burns. There has been some further detections, but we'll get the information for you. Yeah.
Sorry, I just had a question. How many of the cases recorded and you've announced today have been linked to a second aged care facility in Albury?
So there are 2 aged care facilities in Albury that have residents with COVID-19 and staff. So none of the cases today, there are no new cases in the second facility.
And how many are currently in that second facility?
So once again, I want to move away from actual case numbers in facilities. I think we need to allow those people in aged care to have dignity. So we report deaths and we report numbers in LGAs, but we never give out addresses or name areas where there are cases. It's really important to give people that privacy.
And we know it's Mercy Place. Is the second one the southern
So once again, I will not be talking about the name of aged care facilities because that, again, is breaching the privacy of the people who are concerned.
And what's the current turnaround time for COVID tests that are being carried out in Wagga's MLHD clinics?
So the turnaround times generally in our region are really good. So we say between 24 and 36 hours is the usual turnaround time. Some of it depends on the time of which you get tested, but for people who are testing in the morning here in Wagga, we generally have their results within 24 hours.
And there has been this shift to all-day exposure sites where people aren't alerted of the specific time someone might have been somewhere. Has that had an impact? Because that sounds like it would cause a lot more people to feel like they need to go get tests. Has that had an impact, do you feel?
So I think you might be talking about the Service New South Wales alerts that come up. So those are not exposure sites. So if there is an exposure site where we have a public health concern, those are the ones that are listed on the New South Wales website. And if the times are known, then they're publicised. But sometimes people can't remember or they just can't give us that information. So if we feel that it is of concern, we'll put it up on the website. You know, and we saw that last week with the gymnasium in the CBD of Sydney where there was a really significant exposure with a large number of people and we couldn't track them all. So with your Service New South Wales app, if you get one of those red alerts, all that means is monitor for symptoms. It does not mean you should go and have a test. Okay, thank you.
Cool. Thank you.
Thanks everybody.